Hey guys, it's HINA here at Rebalance Physical Therapy and Wellness in Center City, Philadelphia, as well as on the main line in Narberth, Pennsylvania. And our clinic specializes in treating clients with spine, hip, pelvic, and pelvic floor issues. And we deal with lots of different complex issues from postpartum to treating men to treating teenagers all the way up until people in their 90s and beyond sometimes. So today I want to talk to any of you women who potentially had endometriosis surgery and have found that even though they removed a lot of the endometrial tissue and the surgery went successful, that now 2 weeks later or around that standpoint, you're starting to feel pain again in and around that area. And so you possibly might be wondering, oh my gosh, is the endometriosis scar tissue back? Did something happen to my appendix? Did they nick something? And so you're kind of catastrophizing things that are happening in your head. But the one thing that people forget to think about, and even physicians, is that a lot of this could be scar tissue from the actual surgery itself. And we've seen this many times where people will go in, they'll have the endometriosis surgery, everything went beautifully, but a couple of weeks later, starting around the 2-week time frame, they start to feel pain again. So I'm going to discuss with you today what might be going on and what treatment can help. So scar tissue is basically any type, you think of scar tissue as, when you cut yourself on the outside, you form a scab. That's somewhat scar tissue. So imagine the same thing is happening inside the body, okay? So when someone goes in and they're doing, a surgery where they're cutting anything or even creating portals, okay, if you're having an arthroscopic surgery or laparoscopic surgery, okay, where they're kind of putting in, they're making small portals so that they can do the surgery inside. Any of those times where that tissue has to then heal up again, or any tissue that had to be kind of manipulated and moved out of the way, you can create scar tissue in that area. And it's your body's own defense mechanism to kind of heal and what it should do. But sometimes that scar tissue can form in areas that we don't want it to, or unfortunately, some people are more vulnerable to forming scar tissue than other people. Now I'm going to show you a picture of what I mean. Now, this again is the abdominal cut open, and all these white patches right in through here is basically giving you an example of where scar tissue can form. So anytime anyone has any type of abdominal surgery, and in this case, endometrial surgery, okay, they're going to go in and they're going to be cutting a lot of things out. But usually within 2 weeks, you're going to be forming scar tissue, and it's a very normal, natural process that just happens in your body. It's your body's healing mechanism. But what happens at about 2 weeks, the scar tissue starts to really solidify, okay? And then up to 2 years, scar tissue continues to get tighter and stronger. And so what we want to do is we want to catch that time period of when the scar is starting to form and solidify so that we can improve the mobility and the pliability of that scar, so that if that scar tissue is adhering to any organs, whether it's in and around the bladder, in and around the small intestines or the large intestines, that we start to improve that mobility around the scar tissue and start to free it up more so that those organs don't feel bogged down and start becoming dysfunctional. And what do I mean by organs becoming dysfunctional? Well, oftentimes with bladder issues, you can have bladder frequency, you can have bladder pain, you can feel like you have a UTI where you feel like you have to go all the time. You can just get bladder irritation every time your bladder fills. As far as your gastrointestinal system, you can have constipation, you can have excess trapped gas, you can have things that feel like gas pain. You could also have you just feel like your stool is just not working correctly. And the other thing is you have muscles in this area too. And those muscles are called your pelvic floor. And those pelvic floor muscles actually lie way underneath and through this area. And it's kind of like a hammock that your organs rest on. And so sometimes even that scar tissue can start to affect that musculature, which can then make it difficult for someone to have pain-free intercourse or feel like they can insert a tampon or have a gynecologic exam without discomfort. So these are all the things that can happen. Now, oftentimes what people will say is, how do I really know it's not like an appendicitis and this is really scar tissue, especially if the symptoms are on the right side? Well, one of the things that I tell patients, most likely the likelihood that an appendicitis is going to come right after having an endometriosis surgery probably isn't that high. Although you want to make sure that you talk to your physician and make sure that isn't the case. However, if they're like, no, this doesn't seem like it. But the other big thing is, if you are feeling that this pain gets worse with creating any type of intra-abdominal pressure, whether it's leaning back in your chair and you have to contract your abdominal muscles, whether you're coughing or sneezing or having a bowel movement or anything like that, which creates pressure within the abdomen, or laughing or sneezing, things like that, and you feel that sharp pain, most of the time, that's usually going to indicate that this is more musculoskeletal, meaning that there's scar that's affecting the muscles and the fascia and things like that, and that this is something that could be treated. Now, what do you do for treatment? Well, you definitely want to see a skilled pelvic floor physical therapist that really understands how to treat this area and that has taken the relevant coursework to work on this area. And like I said, you have to really find that person, because there might be pelvic floor therapists, but they may not specialize in that area, or they haven't taken the advanced coursework that really understands how to treat this tissue in the correct way to have an effect, but yet not irritate, okay? Because again, you don't want to go in and just start mucking around with scar tissue, especially if it's deep, and you really shouldn't be doing this on your own necessarily. But you should get the guidance of a skilled pelvic floor physical therapist. So what we do in our clinic, I can't talk about what everybody else does, but there are specific hands-on techniques that you can actually treat this scar tissue, and we as skilled therapists can actually feel where these restrictions are, okay? And there could be multiple different places that these restrictions are, and we work with that tissue to improve the mobility and the flexibility of that scar tissue in and around that area. Now, there's a lot of other things that we also evaluate in terms of alignment and your pelvic floor, which are the muscles on the inside, also the coordination of how these muscles are working, because once you start forming scar tissue and you've had a history of endometriosis and all these other things, there's lots of other muscles and fascia that can get involved in addition to the scar tissue. So, but the big take-home message is that we would be really focusing on improving the mobility of this scar tissue with specific hands-on techniques, as well as potentially other devices or what are called modalities that may help this scar tissue along with the hands-on techniques. And usually I tell most of our clients that somewhere between 6 to 8 visits is where you should start really starting to feel a difference, seeing us about once a week. So for those of you who might be having this going on, and you're kind of fearful of what might be going on, and no one has been able to give you necessarily answers as to what's going on, this is probably a good chunk of what the issue is. And so if you do live in and around the Philadelphia area, it's a no-brainer. Come see us if you're having this condition. You may even be able to qualify for a phone or an in-person consult. We'll be able to understand a little bit more about what's going on with your condition and who the best therapist for you to see in our offices, although all of us specialize in this area. But everyone has their nuances of what things they want to get back to. And so we might have a little bit of a specialty in terms of what each of us does. If you do not live in and around this area, then there's a couple of options. Find a pelvic floor physical therapist that understands how to treat through these specific techniques that work on endometrial scar tissue from post-surgery. Otherwise, you can hop onto our website to get additional information, because I'm sure some of you might just be suffering from this, but you might have other stuff in the mix. We have tons of other YouTube videos and helpful information, as well as blog posts. Sign up for our newsletter, find a ton of information on our website, as well as look at a bunch of our other YouTube videos. And like I said, every week we're trying to put on new educational things, and eventually we are going to be getting into treatment videos and things like that that might be helpful. So our website is rebalancept.com. That's REBALANCEPT.com. So come visit us. And I hope this video was helpful for many of you who might be continuing to have issues after endometrial surgery. So hope it was educational and have a wonderful day. Thanks.